Okay, so our next step for Sally is to put an ET tube in to her to intubate. So why we do that is to maintain a patent airway and then also to deliver our anesthetic gas and oxygen. And so once her jaw tone is medium loose, she's probably at stage 3 plane 1, which is exactly where we need her, where her gag swallow reflex is gone and also the laryngeal spasm, laryngeal reflex is gone. So then we can, and first what we want to do is take our ET tube and blow up the cuff and put it into water to make sure there aren't any leaks. So we would do that first. And so then you can take Sally, you would open her mouth. You can use a laryngoscope if you want to, that's more common for cats. And then you would visualize her anatomy. So the glottis would be hanging down over the epiglottis. You can pull it down out of the way, and then you want to go right between the vocal folds. So you would go in, and then you would hopefully hear her cough is sometimes a really good sign that you're in. And then once you're in, you can just secure it on. And you can also use a piece of gauze to hold down their tongue, which is really helpful. So once that's on and ready to go, tight and secure, you want to quickly inflate the cuff, and then it would be like a plump, ripe grape kind of feel, and then you would know that it's tight enough within their trachea. Okay, so some ways that you would know for sure that your ET tube is in is that, like I said before, she might cough as it goes down her throat. You would see fogging in the tube because of her breath. You can also palpate and make sure you just feel that one tube, which would be the trachea, and there's not a tube in the esophagus. You can also, you would hear air movement through it slightly, and then once she's hooked up to the rebreathing bag, which you would do right after you intubate, you would hook her up to the anesthesia machine, which I'll show you next. But once that's done, you can listen with your stethoscope and listen to both sides of her chest to make sure that it's placed appropriately and not just in one bronchi. Okay, so now that Sally's intubated, we can hook her up to our machine. So we're going to take this Y tube from the anesthesia machine and hook it right up to the ET tube. So she's getting gas and anesthesia. You want to turn the gas on, the oxygen on first. Put it out to a maintenance rate of 1.5 liters per minute, and then you can turn the ISO on. Usually you can turn it on high to get them deep into the anesthesia, and then you can turn it down to a maintenance rate of about 1.5%, and then she should be ready to go. And then you can also use some eye lube and put that in both eyes to make sure those stay lubricated. Okay, so now I would take on the role of the general circulating nurse and do the patient's surgical prep. So first we would take her out for a walk, make sure she goes to the bathroom, that's important. If not, we'd have to do manual urine bladder expression. So then we can start to clip her. So turn her over, because we want her in the same position that she would be in for surgery. And then you want to clip. So your margins, remember we're doing a spay, so we want to do from the xiphoid to the pubis, and then about to the edge of the ribs laterally. So, and that would be about 2 clipper widths from the surgical incision. And you want to use your 40 blade, so then you would clip and get all the hair off. And then you want to vacuum it to make sure all that hair is definitely off and it's as clean as possible. And the clipping needs to be neat and symmetric, because that's what the owner is seeing, and then they're going to take your clipping job on how the surgery went as well. So make sure you do a nice job clipping too. Then we're going to do our scrub. So this would be our dirty scrub because we're outside the OR. So we'll do a target pattern, 3 scrubs. So you do Chlorohex, target pattern, going around, always keeping the dirty edge outside so it's not touching the clean. So scrub, and then our rinsing agent, which is alcohol. Again, in the target pattern, going around, keeping the dirty edge out. So we do that 3 times. So then when she's all scrubbed and clipped up, we can give her her Ensure. and that's just a sub-Q injection for pain, and we give that preoperatively now before the surgery to prevent pain. Okay, so now we're in the surgical suite, the OR, and we've got our patient secured with ties. She could be in a V-trough as well. Got her hooked up to some IV fluids, and then we have our warming table on, any other warming devices we would want. Our lights are on and set up. We have an open surgical pack, and our blades all ready to go for the surgeon. So everything is all set up. So then we're going to do our final surgical scrub. So it's with the supplies that are in the surgical room, and it's when she's already set up to go. So then we're going to do the same thing that we did before, but with the target pattern over the surgical site, and then keeping the outside dirty, and the same 3 things of Chlorhex and 3 things of alcohol for 3 scrubs. In our target pattern. So you do that 2 more times, and then we're going to actually get some iodine and then paint that on over the surgical site, and then just leave that. And when the surgeon comes in, he will wipe that off, or she will wipe that off, and then they can start the surgery. Okay, so next I'm going to show you how to do a jugular blood draw. You can clip and use alcohol if you want to, or if you can just visualize it, fine. It's fine to do it without as well. So you would hold off in the jugular groove, have your needle and syringe all ready to go. Once you see that vein bubble up, you can poke and get your blood, pull back, and that's your jugular blood draw, and then you would just hold off until the bleeding has stopped. Okay, so now the surgery is over. The surgeon has finished up. She's all sutured up and ready to go. The last thing you would do as a surgical assistant or a general circulating nurse technician is that you can do the therapeutic laser, and this will help decrease inflammation and help them to heal faster. So now the surgery is over. Her temperature is at 99.5 degrees Fahrenheit. As the anesthetist, I would turn off the anesthetic gas and then just leave her on oxygen for about 5 minutes. And during that time, just continually check her TPR and also all her reflexes that we learned about, just to make sure that she's waking up okay. Also, her temperature should be slightly warming up because she did get a little bit cold, but luckily she stayed within a good range. And then after 5 minutes, we can disconnect her from the anesthesia machine. Just keep monitoring. And then once she swallows about 3 times, we can take out the ET tube. So just do it gently. So you would untie it, deflate the cuff, and then you can pull it gently out. And then just keep monitoring, because that's very important. This is where a lot of emergencies can happen, is in the recovery period. So just monitor really closely, because recovery doesn't end until the patient's vital signs and consciousness return to normal. Also give her her post-op meds now. Okay, so Sally's procedure is all over and she's recovered well. This is our anesthesia record form that we fill out for any anesthesia procedures. So you can see all the details here. And you would take the temperature every 15 minutes and the respiratory rate and heart rate every 5 minutes, and note that on the record along with any other parameters that you're measuring throughout the procedure.